As we look back on this year, this has obviously been a long year for everyone. You think in general, just from a strictly human perspective, everybody's been going through significant changes. We've had children that have been out of school, and so if you're a parent, you know the stresses that have been involved with that. We've seen people's lives and their routines been disrupted significantly. There's been a whole lot of things going on just for everybody across the board. And then when you're thinking about the medical providers, we've been kind of at ground zero of everything that's been happening. Not only are we having to deal with our own personal lives being disrupted, and the fact there's really a lot of times no escape, but at the same point in time, we're having to see in person all the people that are getting ill and seeing many of them that have passed away. As a medical provider, we're not used to seeing something that we can't always cure. Certainly with the healthcare providers, the resiliency they've shown has been absolutely phenomenal. Some of them having to work days and weeks on end, other people having to do jobs that they weren't either initially trained in and having to learn on the spot just so that we can have more people available to help out with patient care. It's been a really great thing to see. When I look at lessons learned, there actually have been several. One of the biggest lessons learned is the fact that I think people now feel it's okay to reach out for behavioral health care. Before, there was a lot of stigma around it, and especially as medical providers and teammates that are involved in the healthcare field, a lot of times we feel like we're the ones giving care and it's not okay for us to ask for help. We should always be strong. We should always be a rock. And the reality is we're all human too. And so with the pandemic and with the increased awareness of behavioral health matters, we've really seen more people reach out for help and the stigma go down.